SINAI-GRACE is an inner-city hospital located in the poorest big city in America. The patient population is 95% black. Cardiac care is very important to this community. I mean, first of all, if you look at all of our health indicators, we're among the sickest communities in the United States. We have the highest incidence of diabetes anywhere. We have the highest incidence of renal failure anywhere. And we have one of the highest reported incidents of chest pain-related illness. Recognizing in the general community and the medical community that there is something called the disparate delivery of care based on class and race. And so the idea behind expecting success, could quality, as defined by evidence-based medicine and high customer service, actually reduce the disparities of care? Our reputation in the community was almost non-existent. There were people who were very, very fearful of the quality of care that they were receiving here, and people who had had horrible customer service experiences. So for us to be able to say to the community, because of our affiliation with Robert Wood Johnson Foundation and their demand to improve our quality, would allow us, if we got better, to say to the community, here you can get the care that you need in a circumstance that you deserve, which you have not been able to get before.
So what we did is put a multidisciplinary team, a physician, a nurse, and a social worker to be able to provide the medical care as well as social care, especially if patients did not have the ability to pay, did not have a physician. We would hook them up with someone. We evaluate all of our patients while they are in the hospital and refer them to our multidisciplinary heart failure clinic, such that we can continue to monitor them and control their education. And as we look at those patients that we are seeing in the Healthy Heart program, the readmission rate is significantly less than those patients that are not seen.
All along the way, the hospital got better. All along the way, people inside the hospital began to have a better attitude about themselves, because we were able to show the community, show our board, that the work that we were involved in was of equal to or better than a great many important hospital facilities in the entire country.
Expecting success is more than just about 10 hospitals who have come together to improve quality for African Americans and Latinos. It's about spreading innovation. It's about spreading change and a will to change across the country. We're trying to get it out there that disparities don't have to be tolerated.
Without expecting success, SINAI-GRACE would not have been able to demonstrate to the community or to itself that it was capable of delivering the kind of quality medicine that this community demanded and deserved.
We think high quality care goes beyond their four walls. They're making sure that when people walk out the door, they know how to take their meds. They know when their follow-up appointment is going to be with a physician or a nurse practitioner. They're basically taking high quality care and pushing it out into the community. That's what the Expecting Success Project tries to do, through its inpatient parts and its outpatient parts, to make sure that the whole patient is supported.
When I met Mr. Sweet, he was in such distress. He is 35 years old, came into the emergency room in florid heart failure. He was barely able to breathe. I asked him, do you really want to get some help and you really want to take care of this? And he said yes. So I talked to him about the heart failure clinic.
The last time when I got out, I just felt hopeless, like, what am I going to do? These prescriptions are high. I don't really have any money. I don't have insurance. I can't go see a follow-up doctor because it costs so much money.
We discussed with him lifestyle changes. We monitored his condition. Plus we have assistance with getting and explaining the process for getting insurance. So it has meant a difference between showing up in the emergency on a monthly basis because he didn't understand he needed to take this medication forever, and being able to do what he has to do to control and manage his own heart failure at home.
My heart failure is forever, ongoing. It's not when my pills are over with, I'm done. So I understand that now, and I'm committed 100%. By me being overweight all my life and eating all these bad things, you gotta think like, okay, I gotta plan what I'm gonna eat. I'm not gonna do this. Every day is a struggle.
He's doing extremely well. His blood pressure's controlled. He stated he feels great.
Oh, I come back in the year, I'm gonna be skinny in the waist and pretty in the face. Oh yeah.